Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, March 31st, and this is my daily briefing. So in Missoula County, we are now currently at 14 cases with 184 cases in the state of Montana. There have been 4 deaths in Montana, and those have all been in other counties. We have not had any deaths in Missoula. And so today I have a few topics that I'm going to cover in brief, and then I'm going to provide an update to yesterday's video. So one of the questions that we've been hearing is that people are confused about who can actually get COVID-19. So as I mentioned on Friday, this is a brand new virus, which means that anybody can get it, and no one in our population is immune to it at this point. I know that what might be confusing is that there's some of us that are at higher risk for complications, but that doesn't mean that if you aren't high risk for complications, that you're low risk for getting the disease. Those are two completely different concepts. So your risk of getting it and your risk of complications are not the same. So to be clear, anyone can get COVID-19. Most people who do get COVID-19 are going to experience mild forms of the illness. However, there are some people who are going to get it that are going to have some severe complications. So it's going to take all of us using all of the preventative measures that we've been talking about for the last couple of weeks to minimize the spread, because if anyone can get the disease, that also means that anyone can pass it on to other people. So another question that we've gotten a lot of calls about is why we aren't releasing the names of the cases and where they live or where they work, and why we aren't alerting the public about places where these people have been in our community. So before I jump into that, I just need to review again that this virus is transmitted by droplets, and so simply being in the same building with someone who has the virus does not necessarily mean that everyone that was in the building at the same time was actually at risk for developing the virus. Because with it being droplet spread, that means that they would have to be coughing or sneezing, and those virus particles get put out into the air in that way, and then they fall on surfaces or fall on a person who's standing close to them, or the person standing close to them might be able to breathe in those droplets. So if we have reason to believe that there's a place of concern, or if we believe that you have actually been in close contact with a person who is identified as a positive case of COVID-19, then we will take appropriate actions. We will contact you. We will, if someone spends a lot of time in one specific location and we believe that other members of the public were exposed in that location, we will definitely contact that place of concern and give them appropriate guidance. And if we believe that you have been a contact, we will definitely call and let you know. So on that note, we've also had a lot of questions about why can we not disclose things. So patient protection laws prohibit us from disclosing any information about a patient that might be able to identify that person. We don't provide a name, an occupation, a place of work, their address, their location of quarantine or isolation, because all of those things could jeopardize a person's right to privacy and security. We don't tell you what city, because living in Montana, some of our smaller cities, if we even tell you that there's a case in that city, it's quite possible that that community would be able to identify that person. So we don't disclose the person's healthcare provider or what clinic they went to or what hospital they received testing or treatment in. When all of our privacy protocols are followed, the information is not needed to protect the public. When people are quarantined at home or isolated at home or even isolated under a doctor's care, they're at no risk to the public. And so that's why we are not disclosing that information. You just have to keep in mind that if it were you, you wouldn't want us disclosing private healthcare information about you to the general public either. And we are taking steps that we need to in public health to ensure that people who may have been affected are contacted, which is why we don't feel the need to disclose any of that, not to mention it would just violate all kinds of personal protective rights. So the next thing I wanted to talk about is we were alerted yesterday about some closures in the Nez Perce and Clearwater Forest area. We know that a lot of people here in the Missoula area do like to go recreate and go to the hot springs or run the river, and so I just want to make people aware that the Forest Service in Idaho has closed developed recreational areas and developed campgrounds in the Nez Perce Clearwater Forest, plus some additional recreation sites to prevent the spread of COVID-19. So Jerry Johnson and Weir Hot Springs are definitely both affected by this, as are any developed campgrounds in that forest. If you decide that you want to violate those closures, then that could come with a $5,000 fine. So my recommendation would be that if you plan to do some recreating in a national forest area, just go to their website ahead of time or call the Forest Service ranger station and ask if they have closures in place, just to make sure that you know what what is open and available to you for recreation prior to making a long drive. So I have a little update from yesterday's briefing. I just wanted to clarify some information. You may have seen this update in the text section of our Facebook post and on our media releases. Between the time that we recorded the video yesterday and the time that we actually released the information, we realized that we needed to change two important talking points. I just want to clarify that there is more than one healthcare worker who's tested positive for COVID-19 in more than one healthcare facility. So I just want people to understand that in each case, the healthcare workers were isolated, close contacts have been identified by us and quarantined, and our nurses are checking on them daily. There's no evidence at this time that any healthcare workers have been affected by patients or developed the disease from a patient. It's important to keep in mind that healthcare workers can also be exposed in their personal lives as well as their professional ones on the front line of providing care. So those involved have followed the CDC and local guidelines, and we don't believe that there's a risk to the public or patient care in those cases. So I just wanted to give that little update. Again, we are seeing community spread in our Missoula community, and so it's very important at this time that everyone do take those precautions that we've been talking about, staying 6 feet away from each other, sheltering in place, and staying home as much as possible. It's more important now than ever to make sure that you are following all of those precautions so that we can reduce the risk of spread in our community. That's all I have for my daily briefing today. I will talk to you all again tomorrow. Until then, stay healthy and safe.